Madhu, can you tell me about the mHealth Alliance's projects with the IWG and explain what IWG is?
Sure.
Thanks.
So the UN Secretary General has this Every Woman, Every Child campaign, and as part of this campaign, there's an innovations working group, and the innovations working group has the IWG catalytic grants mechanism, whereby the mHealth Alliance, with support and in partnership with the Norwegian government, NORAD, has received funding to partner with organizations by giving them grants and technical assistance to scale up the effective mHealth interventions.
Oh.
And this is really important, Bernie, because, as you may have heard, or as we all know, that there are a lot of pilots on mHealth.
Yes.
To the extent that people say there are probably more pilots in mHealth than in the airline industry, because each one is looking at working on mHealth interventions with small populations. But the challenge is to scale up those successful approaches in order to create the maximum impact. And the catalytic grants process, the mechanism, helps us to partner with organizations and provide them with not just funding but technical assistance and help them through the process of scaling up their successful pilots.
I see.
And we do that in partnership with the World Health Organization, who are our technical partners of this.
So many people involved, many organizations involved.
Many organizations involved. So we have provided grants to about 26 grantees over 3 rounds. So each round is for 2 years. It's a small catalytic grant that's given to an organization for 2 years. And the 26 grantees till now are in 14 countries and have already reached about 31 million people.
Wow.
Yeah.
That's great. Now, can you talk a little bit about what types of work that they're doing, or perhaps the categories of projects?
So the grantees are selected through a very rigorous process of selection, because we need to sort of understand and make sure that the scale-up is of proven, demonstrated mHealth applications or interventions. And through that process, we have organizations that are actually focusing on various aspects of mHealth intervention. So there's some who are focusing on improving the maternal, newborn and child health outcomes by providing direct-to-client services. So it could be through SMS messages that are sent to either pregnant women or new mothers.
Yes.
Women who just delivered and need to have information about how to take care of themselves, but also their newborns, in order to impact the maternal and newborn mortality rates. There are some which have a call-in center. So the women and their families can actually call in to a call center. For example, in Malawi, we are partnering with Village Reach, whereby the women and the men can register to call in to get the information.
I see.
There are organizations that are providing direct-to-client services. There are some organizations that are working on improving the supply chain. So looking at preventing stockouts of drugs, primarily of essential drugs.
Make sure they're in place.
Make sure they're
in the streamline.
In the streamline. Because you don't want a woman who's been motivated to go to a health center at the right time, but then realize that there are no drugs.
Yes.
So there's some that are looking to sort of improve the supply chain and address stockouts. There are some organizations that have looked at working with the frontline workers who are really at the front line of providing services. So they include both at the community level but also at the health clinics level. And this is by developing decision-making and supportive supervision tools for the frontline workers. So if I'm a frontline worker and I'm talking to you, I have the information that I need to provide to you at my fingertips. So I don't have to remember it. And then that gives me much more confidence to provide the client with quality and timely information services and also track the patient.
Confidence and it's more efficient.
Yes, yes.
So,
By and large, these organizations, the partners, the IWG grantees that we're working with, are working with either direct to client or with frontline workers, or to improve the or to reduce the stockouts, mainly to address the goals of the MDGs 4, 5, and 6. So, looking at maternal, newborn, child health goals, the HIV/AIDS and tuberculosis, and malaria.
Okay.
Those are sort of the bigger goals and outcomes.
Okay, and could you also briefly address gender in mHealth? Is that a key issue?
Absolutely. I'm glad you asked, Bernie, because often what we have seen is that in developing an mHealth application, although we are talking about the woman's health, but we talk about everything but that woman. So primarily, more often than not, the mHealth intervention gets, is predominantly dominated by either the technology sort of folks who are looking at, whether it should be an SMS, whether it should be, or which platform to use, or which channel
the processes.
To use. Yeah. Or it is the traditional public health, and I'm a public health professional myself. So it's about getting to clinical, like what kind of information do I provide, and is it at the appropriate stage or not? And somewhere we don't take into account the woman we are actually trying to influence.
Gets into the background.
Yeah, whether as a client or as a frontline worker. And there have been many studies that have been done by GSMA's mWomen organization that brings out the issues and challenges that the woman faces as a client or as a frontline worker. So the first issue is, we assume that if I am coming to your clinic and I'm coming with a mobile phone, it's owned by me.
I see.
Which it's not. More often than not, my husband owns it. Or even if I own it, I don't control it. It's my husband who controls it.
So you have to take that into account.
So I have to take that into account. So, I've received the SMS message. So you need to sort of figure out whether, when I've received the message, A, do I have the ability to read that message? B, if I read that message, do I have the decision-making authority and power to implement the action? So I have received an SMS message that I need to go for my antenatal checkup, and I know it's important for my body. But most often than not, whether I should go to the clinic, that decision is made either by my husband or by mother-in-law. And, so sometimes we kind of don't take into account the gender dynamics within the household that impacts my ability to either read the information or receive the information, but change that information into the appropriate behavior.
And understanding that will help bring better focus.
Absolutely, because so for example, a lot of organizations, I can tell you, Grameen, Motec, have now sort of having understood this dynamics, have started developing messages for the husbands and mother-in-law as well.
Oh.
To make sure
so
that they are
seems
part of
simple,
the decision making. But I think we need to take that context into account, because otherwise what happens is that we've heard anecdotes. There have not been, many systematic research that has been done on this, but field experiences, anecdotes have told us, what we heard from women is that sometimes with good intention, mHealth interventions that develop with good intentions can lead to unintended negative consequences.
Yes.
So, for example, in Bihar, one of the states in India, when we were talking to frontline workers, they were talking about, when the phones were given to the frontline workers, they felt extremely happy. And, once they were sort of trained how to use it, they were very confident. And, the self-efficacy went up, they felt empowered. But as they had the phones, the husbands probably become suspicious. There's a potential that either as a woman, as a client, or a frontline worker, when I start using the phone too much, the husband becomes suspicious of my activities. I
see.
And that can lead to gender-based violence at home, or partner violence at home. And that's what the GSMA report, the mWomen's report has also talked about, the increase, most often than not, women don't want to be using the cell phone because they fear that their husband would
they're afraid of that.
And, so again, we have to look at the implications of our intervention. So a frontline worker who feels very empowered goes back home, and, so two things can potentially happen. that the husband says, like, you know, why are you using the phone so much? Why are you going out so much? And that can lead to, you know, clash or sort of issues in the household. Or, you know, the fact that now I feel very empowered and I have information on my fingertips, which helps me to make good decisions at work. That translates to, you know, my ability to make decisions in the household. So I become much more vocal in the household decisions. And the husband tells me, like, oh, that's because of the silly phone. Give me that phone, and from tomorrow onwards, you're not going to work.
Yeah, so it's a very tricky situation.
Yeah. So I guess, you know, we have to understand the implications of the mHealth interventions in terms of the unintended negative consequences, as well as what is the gender dynamics that we need to take into account to make sure that the woman that we want to ultimately benefit or influence is able to do so within the household context.
Okay.
So I think, you know, that gender piece, you know, most often than not does not get sort of integrated in designing mHealth interventions.
Thank you very much.
Thank you.